when she came back from the US. And this pitching competition in the healthcare field is a very welcome one. And we're happy that it's being piloted in the Philippines, thanks to Takeda. And moving forward, please allow me to acknowledge our friends from the media who are here to support us. You know, weekends are usually their rest days, but they're here with us. Thank you very much. Oh, well, of course, others are still on their way. So we have Riz Raul Reyes from Business Mirror. We have Rainier Alan Ronda from Philstar, who's on his way. We also have Junix Doronia from the Manila Standard today. Benedict Abaygar from Global News Network. We have Jasper J. Mante Tan Mangbidan from DZME. Ed Usman from newsbites.ph. From the blogging community, we have Mac Vasquez and Michelle Rose Campos. We have Ross Del Rosario from Wazzup, Pilipinas. Rivera from Swirling Over Coffee. And with him is Ana Pangkoga. So thank you very much. I'd also like to acknowledge our friends from the stakeholder community, no? So we have from Takeda, Abby and Sisa. Miss Abby and Sisa, the marketing director. We also have Craig the Large. Also from Takeda. And we have Dr. Gia Sison. Dr. Iris Tiel Isiptan. We have Dr. Luis Sison from UP Health Informatics. Dr. Ted Herbosa, also from PGH. We have Farouk Merali from M Clinica. Well, of course, we will be part of the panel. We have, of course, Jerome Wang, also from Takeda. Still from Takeda. Thank you very much for your support. I hope I didn't miss anyone. So today, 10 finalists chosen from entries all over the world will present digital solutions in the area of oncology. By end of day, we will know what solution our esteemed judges chose as the best at improving people's lives and will bring home the prize startup fund of $10,000 US. And now may I call on Gabriel, Georgy, President and General Manager of Takeda Healthcare Philippines, who will tell us more about the Takeda Digital Healthcare Innovation Challenge Pitching Competition.
Thank you, Doris. Fantastic. Well, good afternoon. Magandang hapon.
Hapon.
Saya akong makapiling kayong lahat. It really is a pleasure to be with you today, and I thank you for taking the time to actually be here. I know it's a Saturday. Now my 9-year-old daughter said to me, "Daddy, do you really have to go to work today?" Yes, I do. So, on behalf of my colleagues in Takeda, we really, truly appreciate you taking the time to be here with us today. So over the next few minutes, I'll just give you a little background about Takeda, a little bit about the competition, and then I'll ask my guests from the panel, we'll sit out the front here, and then you can ask us questions individually as well. Okay? So Takeda, believe it or not, is 235 years old. So we started in 1781 in Osaka, Japan, and our headquarters are still based in Osaka, Japan. We're a very patient-focused organization, so you'll see a lot of phrases we use is the patient is at the center of everything we do, and we really mean that. And all the solutions, all the innovations we come up with, whatever we're talking about today, these innovations that are going to be presented in the next few hours, these are really all about the Filipino patients. Globally, we're about 32,000 employees, and we focus on 4 key therapeutic areas, being GI, gastroenterology, oncology, which is cancers, CNS, which is central nervous system, and vaccines. And sort of one of the exciting things we want to bring you in the future, especially in the Philippines, is a vaccination for dengue. And so we are really looking forward to bringing that out in the future. So this young man you see in the picture here is Shohei Takeda, the gentleman who started Takeda for us many, many years ago. Oops. Sorry, I've got to Okay, so our mission is to strive towards better health and a brighter future for people worldwide through leading innovations in medicine. And we make no apology for the use of innovation. So it's whether innovation in medicine, innovation in technology, innovation in the way we do things. We're really serious about innovation. It's actually, Takeda is committed about innovation, which is why we are here today. And I thank you again for being here today. We have 4 values that have been brought down to us from Shohei Takeda 235 years ago. That's integrity, fairness, honesty, and perseverance. This is really what drives us every single day and what governs our work. So, likewise, in the Philippines, we're about 235 employees, 250 employees, sorry, we're a prescription medicines company predominantly, and we focus on GI, oncology, cardiovascular, and bone. So we're the #1 GI company in the Philippines, and we're the #1 anti-osteoporosis company in the Philippines as well. We also have a product for Hodgkin's lymphoma, which is really what's brought us together today. And we engage a lot in CSR, corporate social responsibility. So Takeda engaged in 22 individual events last year across the Philippines. 22. We've even compiled a CSR storybook. And I participated in 2 of those myself, where I went to an orphanage for kids. I actually went to an orphanage for older people. You know, and it really breaks your heart to see people in that state. But we will do all we can here in the Philippines to engage in social responsibility. And it's something we're very proud of. So, what's the challenge all about? Really, it's about helping tech startups in the Philippines and of course across the world to come up with a medical innovation. A medical innovation that we can make patients' lives easier. So this innovation can be a website, could be an app, could be some hardware, some software. We've left it up to the imagination of the people who are presenting. And I'm looking forward to seeing the actual presentations today. So the Philippines really is a perfect place to be doing this. And I'll explain why in a second. But like I said, Takeda is committed to digital. And if I allow me to quote this from Craig, which says, Takeda aspires to be a digital leader in pharma. And these types of events are part of our efforts to be a part of local digital health ecosystems to advance the use of digital methods to improve patients' health. And Craig is with us here today, so Craig, thank you for joining us all the way from Singapore. So we are really committed to innovation, and more so, I would actually encourage other corporates to engage the tech community as well. So the good thing for us is actually, we are the first. Takeda Philippines is the first country across the Takeda world, 75 countries, we are the first country to be launching this Digital Healthcare Innovation Challenge. Really, so we're thank you. Likewise, we're also the first pharmaceutical company in the Philippines to be engaging the tech community. So we're really proud of that as well. And I encourage other corporates as well to engage the tech community to bring these innovations to the Filipino patients. And so you've seen these questions before, they've been given to you in your media kit, but really our aim is to reach more Filipino patients, because the patient really is at the center of everything we do. So just in my last few slides, just a little bit about what's brought us together, a disease called Hodgkin's lymphoma. And so approximately 60% of cancer patients diagnosed will die. Okay? So this is the statistics that we got from Globo Cancer 2012, a report that came out here in the Philippines. So roughly 110,000 cases of cancer, about 3,500 new cases every single year, and expected to grow. And this is just fact of life, it's reality. But the public awareness generally is quite low. And you know, we have 7,107 islands in the Philippines. Getting access to medical facilities, going from one of the outlying islands in the provinces to a major city is difficult for many of our fellow Filipinos. So this is where digital innovation can help, where we can actually bring the medicine or the technology to the patient and from the patient back into the main cities across the country. And this is what we are all about. So why the Philippines, I've been asked. And there are three main reasons why the Philippines is the first country. First, we have many startups here in the Philippines, really, and I know Jay and many others have also embraced the startup community, so well done on that. Likewise, there's a strong proficiency in English in the Philippines. It's quite easy to communicate here, which is great. And really the big one for me is Filipinos have actually embraced digital technology. They've embraced innovation. And so with the work that Tina's doing with Noltex, this is really bringing more of these digital innovations into the community. Okay, so what happens next? In the next few hours, well, after the press conference today, we can move over into the room next door. There will be the top 10 finalists will get to present their piece. They'll have 10 minutes each. And then the judging panel, we will have a score sheet. We'll decide who the winner is going to be. And at the end of the day, we'll formally announce who that winner will be. And so we've got experts in the room with us today, which I'll introduce later on. But this is really now crunch time for us. This is really where the pitching competition is coming out. So we're actually quite excited about this. So on a final note, again, I want to thank you for being here on a Saturday, for taking the time to be with us. If I can invite the panel, please, to come to the front, to sit over here, and then we're more than happy to take questions from the